can you show us your other product there?
The other thing I want to show you here, this is a 4G modem, and it's actually, I'll show you guys on the screen. I'll try to make it as good as I can.
Aim right there.
Okay. There we go.
I think I speak for the whole chat room when they say, ooh, ah.
So this is about a 1/2 inch thick and maybe 3 inches square, and this is basically a 3G and 4G modem. So what's great, no matter where you live in the U.S., you can buy this device, and you can leverage any of our networks that you can get access to. We cover about 30 million pops. Obviously, Atlanta is one of the cities we've launched with 4G. And we'll cover 120 million pops, or a little better than 1/3 of the country by the end of the year. Now, what's also cool about this device right here is it enables 5 simultaneous Wi-Fi connections. So we have 3 doctors here in the room, and then one of my colleagues from Sprint. We could all have a laptop, and we could turn this on, and we could run every laptop on this. Or we could run healthcare equipment, printers. I see there's a camera over there. Anything that has a Wi-Fi connection could be enabled over this, and we could just carry it around the city. Or, by the way, yesterday we had somebody stop by. They had driven up from Florida, and they were using one of our devices and had 3 people in the car, and they were all just cranking away using this device. So be in a car, at a convention, wherever you might be.
Well, we'd be happy to demo that, if you need somebody to demo that. Other questions?
Just to give you a feel of what's going on in the chat room, there's some comments more than questions. We have an emergency room physician in Texas who says, unfortunately, this really cool technology will just result in being told go to the ER 10 minutes earlier. And then another person said, gosh, that 4G device looks fabulous. It would look even better with an Apple logo on it. So that's not really a question.
I'm thinking back to my memories of being a resident on the wards. Do you imagine a use for the technology just among healthcare providers to exchange images just real time in the hospital? Because one intern gets an EKG, wants to share it with the chief resident or something like that. Is anything?
Yeah, that's actually another great question. We never really talked about the in-hospital environment, and there's a few things that we are doing, and I won't mention names because some of these I'm not able to, but one thing that we're doing is we call these customer converged network solutions, where we go in and basically wirelessly enable every nook and cranny of a hospital environment. And the purpose of that is, rather than think of that as remote and mobile, it's a very portable environment. So the example just given is, our doctors and clinicians are all over this hospital, and they don't want to go find some place to plug in necessarily. So if we come in and we basically wirelessly enable this entire hospital, no matter where they are, the OR, the ER, the ICU, then that information being captured on their mobile device, could be a tablet, could be a laptop, could be a smartphone, and being able to share that either inside the hospital or outside the hospital at any time is actually a really important element. Well, the discussion I had yesterday with a major hospital provider is they're looking at basically getting rid of all desk phones and all tethered units. We use tethered as in wired, and basically wirelessly enabling the entire hospital. And it's also over a secure frequency. One thing about Wi-Fi is it's great, and I'm not suggesting Wi-Fi is bad. Wi-Fi is great, but sometimes you're a little concerned about the environments and who you allow to have access to that. With our 4G or with our 3G, it's private spectrum, and so you have much more control over it in those environments. But I think that's a great point. And for the person who would like to see an Apple insignia on this, I can't help you with that, but I can tell you, if you got one of those iPhones and it's basically a bookend because you can't get data, buy one of these and you can actually make it work. It's phenomenal. You can actually have real speed on an iPhone if you buy one of these from Sprint. Wow. Man. Okay, this will be our last meeting here at HIMSS. One question.
One question. What happens when the tower goes down?
Yeah, so that's a really good question too. Towers don't generally go down. Unlike landlines tend to get dug up. That's generally, when you lose connections normally in just a normal day-to-day environment, it's someone has accidentally dug up a wire. So your towers generally only go down when you have a very adverse, earthquake, hurricane or something like that. And generally when that happens, what we try to do is harden all of these networks to the extent that we can. And then in the example that I talked about where we enable the entire hospital environment, the tower actually can be contained within the hospital and is usually backed up by generators. So it almost has its own cell tower, and then wireline backup from there. So the backhaul, if you will, from the tower is underground. So when we do a hospital environment, then it works great. Now, obviously, if you're talking the broader residential arena, if you have a catastrophic event, it doesn't matter wired or wireless, you're going to have problems. One of the solutions that we're actually starting to do, though, in the 4G, 3G world, those are two different networks. So in many, many cases, what you want is if you can have redundancy, that's your preference. So the fact that our 4G network and our 3G network are independent networks, if one goes down for some technological reason, you've actually got two wireless options, and that redundancy is very important, obviously, for many, many reasons.
Great. Okay.
People are getting chatty now. So one person is saying that in their ED they've tried two different cell networks, and the first was Sprint, but they had difficulty getting them to work well enough to be able to make the switch from wired phones. I guess the reception just didn't work in the bowels of the hospital. Any thoughts on that? Have you had some advances that make that now in this day a less likely problem?
It's a great question. If you rely on the macro network, all wireless networks are constrained from an RF perspective by buildings, right? Especially you think of a hospital, they're actually constructed, how they're constructed hopefully is a very sturdy construction. So what we do, I used the Methodist healthcare system, Dan mentioned this yesterday, we go in and literally build what we call a DAS, and it's a distributed antenna system. And basically what we do is we put mini antennas throughout the entire facility. And we create a tower just for that hospital, and then we distribute the signal. We literally distribute the signal throughout the bowels of the entire hospital. And we've done this for, a few major hospital systems, quite a few major hospital systems. Then if you're relying on just what I'll call the macro network and thinking that that's going to be able to give you access in every nook and cranny of your hospital, that's not going to work. You're going to want to do this, and we call it a custom network build. And, in many cases, it's at no cost to the provider. What we ask for in return is, hey, let's put some units on here, give us some subscribers, and then it reduces the capital expenditures that has to be put forth by the entity. We end up putting the capital in kind of in return for services.
Great. One more?
Yep, one more. A few people have been asking about how soon will 4G be available for hospitals nationwide?
Another great question. We can actually build 4G almost anywhere in the United States. We own spectrum positions in about 80% of the United States. We launch markets, one market at a time, but today we would actually, outside of a launch market, we could put 4G in a hospital. We have the spectrum position. It would be this group that actually reports up to me where we go in and do these custom builds. We can do that whether we've launched the market or not. So we could go to, I'll make this up, we could go to Phoenix, Arizona, which we have not launched, and we could put in a 4G network for that hospital or for that, it might be a complex. We could actually build basically their own little private 4G island.
Great. All right. So for people here on site at HIMSS, where can they find you on the exhibit floor? And for people who are watching here, where can they read more about the Sprint Health IT initiatives?
Okay, so our booth is 1413. In Hall C or C Hall or whatever it's called, Hall C. And, I very much encourage you to go by and just look at some of the applications. The great thing is, like I said, the stuff I'm talking about today, whether it's 4G or it's this remote healthcare, it's actually demoed in there. We've got Creative Labs in-person devices where you can see video conferencing. It's real. It's going on right now. So I encourage you to stop by the booth because sometimes we all come and talk about vision stuff. This is real, and it's actually being demonstrated at our booth. So I encourage you to stop by if you want to see it brought to life.
And they can read more about it like sprint.com somewhere?
Yep, sprint.com /healthcare. Sprint.com /healthcare.
Great. Tim Donahue, Vice President Industry Solutions from Sprint and iPhone Lover.
Right.
Thank you for joining us here. Thanks for the time.
All right. Thank you very much.
Great. And Better Health's coverage here live at HIMSS 10 will be continuing in a few minutes. We'll be right back.